All right, good afternoon, everybody. Here with Josh and Paul and a couple of other friends I'll introduce in just a minute. Time to give you an update where we are in COVID, but first I thought you might find this analysis from the Bureau of Economic Analysis of interest. It's first quarter economic growth, and it's interesting to me on a couple of fronts. Connecticut did relatively well. The darker the color, the better you did. And Connecticut down 4.6%, nothing to boast about, but compared to the rest of the Northeast, we did relatively well. I think that's in part because we kept manufacturing open, outdoor construction. These numbers are going to change a lot in the next quarter, by the way. Sort of interesting, if you look at the chart, you can see solid blue kind of going down the very middle of the country, from North Dakota down through Texas. And probably Nebraska at negative 1.3 is the best of a sorry bunch. Everything is negative across the country for the first quarter. And, frankly, COVID was just getting going there in February and March. I'm afraid you're going to see places like Arizona and Texas, which are dark blue, which is good now, probably take a hit in the next quarter given the flare-ups there. So this will change. But it gives you an idea of what's going on around the country. The next chart is sort of, one more time, I'll tell you about the PPP loans, the Paycheck Protection Program. And it's a little like 40 acres and a mule. It's really a big giveaway that the federal government has done for good purpose, I would say. And it's just interesting, again, that we had 58,000 small businesses across Connecticut get funding, a total of $6.6 billion. We did pretty well. We did 8th best in the nation on a per capita basis. We always find out when Connecticut's at the bottom of a list. It's worth noting when we're near the top of a list. But most importantly, I wanted you to remember that the PPP program is still open. It's still available. It's available to small business. It's available to not-for-profits. And we are there to help. It's available now through August 8th, and there's well over $100 billion still in that fund. And I would write this down, 860-500-2333. You've got Gwendolyn, you've got David, who you've known before, our folks at DECD. We will help you get to the front of that line. We've done pretty well in helping other businesses. And this is money that's a lot more flexible than it was just a few months ago. Primarily goes to keep people employed. And this will give you 2 to 3 months that hopefully gets you in a place where the economy is able to take off and keep you going. So ct.gov coronavirus. I would jot that down. Next up is our COVID daily summary. I think it's a continuation of where we've been. You take a look at 101 positive cases out of 8,000 tests performed, a little over 1%. You may go, hey, what happened? I thought we were at 0.6% just a week ago. This still puts us really near the top of the heap, best in the country in terms of a very low infection rate. World Health Organization says anything less than 5% is pretty good, and our 7-day moving average is still about 1%, which gives us some confidence when we start talking about what we want to reopen schools and the such. Fatalities, 5, a sad, lingering number of people, and hospitalizations +2. And we'll talk about hospitalizations in the next chart. I wanted to explain what I thought was important about hospitalizations. A few months ago, that net number was very important, meaning as we got to the capacity of our hospitals, we worried about the fact that we may run out of ICU space, intensive care units, and that was very important to us as we talked about net hospitalizations. Now I think you can see that hospitalizations are bouncing around a little bit. We've been below 100 for quite a while, as you know. And I explained before, I'd be worried that we see a little tick up in hospitalizations, if not for the fact that our admissions are flat or even on a slight downward trend. That means we don't have the flare-ups that you see in some of the other states. I'll tell you, 48 hospitals in Florida have reached capacity or near capacity right now. You're going to see we're not close to that. The reason we're bumping around is because we're near the bottom, and so there's not much further to go down. And what you've seen there in the bottom of that chart is discharges. And you can see the discharges were significant, say 80 plus just a little over a month ago, and now our discharges are maybe at 20. So that's the variable that means the hospitalizations will jump around a little bit. The next chart sort of reflects that in a slightly different way. I've showed it before, but I'd like to show it again. You can see when we started reopening there, and that's the red line. And you can see we've gone down dramatically. What's important to note is hospitalizations, that the blue vertical line is down dramatically. So whether we're at 70 hospitalizations COVID-related or 102 is less important than the fact you can see we've got a lot of good capacity there. And the positive test results continue to be extraordinarily low, in and around 1%. And we had a bit of a celebration today. We got together with Hartford Hospital. They've conducted now 100,000 tests. And Connecticut is top 10 in the country per capita when it comes to testing. And that's obviously important as we get the lay of the land, as we think about reopening of schools and the such, to have a better sense of where we stand. Testing gives us that confidence, gives you that confidence, and it's really key to making sure your community is safe. We still have some excess capacity in our testing, and that's what we are trying to relay. You don't see that in other states, those hotspot states, Arizona, Texas, Florida. They're, what did they say? I think the Hartford Courant called it a red hot mess when it comes to what you see in testing in those states, because people are getting worried, and rightfully so, and there are long lines for testing. So I take advantage of where we are as a state right now when we have the testing capacity. 160 testing sites, generally nearby, wherever you might be. Some of them you can go right to 211, and you'll find 211 will tell you where the testing site is closest to you. Just put in your zip code, off it goes. It'll tell you those sites you can go asymptomatic, those that are symptomatic, those you are a quick drive-through, get you an immediate result. This is a time to take advantage of the fact that we have good testing capacity right now and get ahead of the curve. And while I'm at it, when it comes to hospitals, because we have good capacity in our hospitals, they are doing surgeries, they are doing elective surgeries, they are doing vaccinations, they are doing mammograms, and all the tests that maybe you have put out for a while. Hospitals down in the south where there are flare-ups, they're not doing those type of procedures, those surgeries. So I would urge you, this is no time to put them off. Take advantage of the good position that we're in right now. And it's because these metrics are positive for the state of Connecticut, because our hospitalizations give us plenty of capacities, because our infection rate is low, because the positivity rate stays low. That is the reason that we are moving forward with our reopening strategy for our schools starting in September on time. And I was just on a conference call with a Zoom call, to be exact, with a couple of thousand educators, and Deirdre Gifford, who's on with us as well, and Miguel Cordona, our Commissioner of Education. And what we told the educators all across the state was several basic messages. One, everything the state has done since the beginning of COVID has been seen through a public health lens. That is our number one priority when it came to closing down different pieces of our economy, as it comes to methodically opening up our economy. And that's what it means when we say we think we can open up our schools safely in early September. We're doing this based upon the metrics, based upon the trend lines, and nothing else. I know there's been some hot rhetoric coming out of the White House, and if you don't open, we're going to hold back your funding, and don't be a wimp. We're not listening to that. what we're listening to is the science, we're listening to the public health officials, and we're looking at the numbers to give you confidence that we can do this safely. Miguel has sent out, I think it's a couple weeks ago now, our 50-page analysis on how you can open your schools safely. And we're here to answer any questions just like we did on the Zoom conference today. And this is a request that we're getting from other states around the country, but more importantly, now this has gone back to our superintendents and our teachers and parents and stakeholders. They're taking a look at this, our guidelines, and applying that to their school. And then they're going to come back to us, state government, in the next couple of weeks and say, this is what works for us, this is where I think we can see improvement, and this is the financing we would need in order to be able to do this safely and expeditiously. And we're there as a backstop for our school districts to make sure they can open safely and expeditiously and give them the public health support they need and give them the financial support they need. I just wanted to know where we were in that process. And with that, as I said, Miguel and Deirdre are on, as well as Josh and Paul, and happy to answer any questions you may have.
WTIC 1080 News.
Thank you. For Commissioner Cardona, what's the latest? A lot of talk about schools around the country. Interesting that Ron DeSantis just said in Florida that if you can open a Walmart or you can open a Home Depot, you can open schools. It's not quite the same thing, is it?
Certainly isn't. And we know that comparisons like that don't help build the confidence that we need to build to ensure health and safety for all. And we're working hard to make sure that the plan that we rolled out is getting input now from district leaders and school leaders and teachers so that they can make it work for their district. And then they're going to communicate with us where there are issues, pain points that might need extra support. So that's where we are. But comparing it to things like that, I don't know that that's helpful.
Specifically, locally, what are you hearing from some of the teachers as far as their concerns about being close to students in a small classroom with a lot of kids? Right.
We have heard a lot of concerns, a lot of fear, and that's natural. Teachers have communicated concerns about, their own conditions. They might have pre-existing conditions, and that's something that we take very seriously. We're working with DPH to try to communicate as best we can how we want to make sure those safeguards are clear. And we're also recognizing that there are ways that districts could accommodate where possible, but also offer whatever ADA accommodations that are required by law. So we'll be communicating that information continuously, and we recognize the concerns that teachers have, but we want to work with them to help come up with some solutions for that.
Channel 3 Eyewitness News.
Yes, Governor, sticking on that school theme, we saw more than 300 questions during that school teleconference coming in from concerned parents and teachers. Do we have an idea of how many students actually plan to return to the in-classroom learning in the fall?
Well, I can start with that. What Miguel is doing with all the superintendents is a survey just to answer that very question. There's nothing like in-classroom learning. What we heard from teachers is, the sense of isolation a lot of students feel, get back, social and emotional, as well as the, academic learning part of this. But not every student necessarily is going to want to come back to school, or their parents. So we're getting a good idea of what that percentage of folks may be. Miguel's looking at how we can do telecommunications and distance learning to facilitate that. And that will, of course, open up some space in our classrooms as well. And we're going to have a good idea of that, Miguel, in the next 2 or 3 weeks, you think?
That's the expectation, yes.
And just to follow up, air ventilation has been a big topic this week, with medical experts saying that the virus may be more airborne than initially thought. Do we know how that's going to affect schools and even just the reopening in general?
Yeah, we've done a lot of analysis, frankly, just in the last couple of weeks in terms of filtration systems, that the quality of the system you need to filter out a COVID-related like germ, And Miguel's team is looking at the ventilation systems and the airflow systems across all of our schools to see what we can do on an expeditious basis.
Do you think it's adequate?
I think it makes a difference. What we've heard about the airborne nature of the COVID germ is if we can do more to increase circulation, we know the difference between outdoors and indoors in terms of infection rates, and what we can do in terms of indoors to make sure that we have the filters in place that could limit the flow of a germ. In the rare case that could happen, it could make a difference, yeah.
News 8.
Good afternoon, everyone. If I may ask Miguel one question and Governor a question as well. Miguel, I spoke to a couple of teachers today. One of the concerns that they brought up is, what if one of them, whether it's on their own, gets sick and has to, self-quarantine for a couple of weeks? Their concern was who takes over, because there's a kind of a shortage of substitutes, and how would that work? And then for the governor, with respect to a possible second wave and PPE equipment, where do we stand with that, and what can you use maybe in learning from going through it the first time where it's so competitive?
I'm happy to jump in with the first question. We are working with our talent department to identify teachers that are in Connecticut who have certification but are not necessarily using it. We're providing that information to districts so that they can have a bank of substitute teachers available to help. We know that that's something that has to be part of the planning so that we don't end up moving students from one classroom to another classroom and then creating an environment where we have more students in a class than there should be.
And regarding the second wave, I'll start and pass this to Josh, since they've had meetings, including one today, on how we prepare for what could be a second surge. But a couple of different things. One, we are restocking our PPE right there at the New Britain warehouse. We're not waiting for some stockpile from Washington, D.C. or flights from China. We've established strong corporate relationships with major suppliers, and that is continuing to come in, although some of the stuff is getting quite competitive now, like the N95 masks. Again, we've got much more testing capacity than we had back in March and April, and so does the country. So it'll be better there, as well as track and trace. So I'm going to do everything I can to make sure that that does not happen. That's why we're putting public health first. That's why we're so strict about the reopening and the protocols and wearing the mask. But if it does happen, we'll be ready.
NBC Connecticut.
Hi, Governor. The data on Connecticut's progress against the coronavirus doesn't seem to be convincing all parents that it's safe to return to school based on their comments to us. How do you instill confidence in your plan with the public, and especially with parents?
By telling you that we have erred on the side of caution since the very beginning. We were one of the first to close down. We were one of the first to get masks and the protocols in place. We were not one of the early ones to open up. We were cautious when it came to opening up. And so far, the strategy seems to be working, looking at the numbers you've got there. I'm not going to sugarcoat it, though. I mean, you could say, I don't want to go back to school until there's a vaccine or until there's a 0%, infections. You have to make a judgment. But I think so far we've made reasonably good judgments that are keeping your family safe, your teachers safe, and your kids safe.
Going back to the airborne nature of the coronavirus and the report from the WHO that in crowded spaces, that could be a bigger risk. With some of the indoor venues that have been paused as part of phase 3, do you see putting in place stricter filtration requirements before they can open?
Want to try that one, Josh?
Yeah, as the governor mentioned a moment ago, we're looking very closely with a lot of the experts in this area around air filtration systems, ways that existing HVAC systems can be increase the airflow, improve the filters, potentially introduce UV light that can help kill the virus that gets trapped in the filters. So there's a variety of different areas that we're looking at that can all help in that regard.
Thank you.
Hearst, Connecticut Media.
Thanks, Max. Commissioner, could I ask you what you tell teachers who have concerns about their own health issues and who are wary about getting back into the classroom?
Right. I think part of the design of our rollout is to give districts an opportunity to develop plans and communicate it so that they understand what their local district is doing and how what accommodations could be made, but also what safeguards are being placed in their classroom, in their school. We also recognize that for some teachers, they may feel uncomfortable going in, and we want to be very clear what their contractual rights are and what their legal rights are with regard to using time or making decisions that are personal. So we want to be very open about that, but we also want to give districts an opportunity to come up with the plans that are going to be, I think, more relevant for those teachers because they're going to be working in those districts.
Thanks. Hey, Josh, what's the report from the field on overall social distancing? Are people still adhering close enough to masks and 6 feet and 15 feet at the beach and all that?
It's something we're constantly concerned about. You know, when we're all out and about, you know, I think we see varying levels of compliance with the governor's executive order around wearing face coverings. Commissioner Gifford could comment on this as well, but we're really continuing to work hard to get the message out about the importance. I think when we look at some of these states in the South that are seeing flare-ups, one of the constant themes is that these are states that overwhelmingly do not believe or do not adhere to some of the good practices, the public health practices around face coverings. I think it's becoming increasingly clear that this really makes a huge difference. We really need people to follow these rules. And in particular, we're looking at additional creative ways to get these messages across to some of the younger generations, which we know in other states in particular, the compliance is a challenge.
Could the commissioner, the public health commissioner, also chime in?
Yes, I'd be happy to. One thing I'll add to what Josh said, we do continue to be concerned about instances where people are out and about, mostly I think outdoors, less so indoors, but people are not physically distancing and also not wearing masks. And I wanted to just say that, to remind us all that wearing a face covering is something we do for one another. It provides us some personal protection from a droplet or an aerosolized virus, but mostly it prevents us who may be spreading the virus from spreading it to someone else. So as we think about, you know, taking care of one another and getting through to the other side of this pandemic, wearing a face covering whenever you're in a group is probably one of the most important things we can do to respect one another, to care for one another, and to make sure that Connecticut avoids a second wave.
Governor, you might be surprised that there's still politics being played in the state of Connecticut during this crisis, but the state Republican Party is setting up a hotline for people who find absentee ballot problems in the upcoming primary. Do you have an opinion about this, or do you think this is a political stunt, or what do you think about it?
I'm shocked to hear there's gambling in Casablanca, but no, I mean, I guess it's a bit of a political game. I don't want older folks in particular, folks who fear for their health, to have to go line up at the ballot box. August is going to be a forerunner to what's going to happen in November. November is going to be a very big election. So if they don't like our plan for absentee balloting, what are they saying? Line up and take your medicine? That's my thoughts.
Thanks, Governor. Thanks, Max.
Fox 61.
Hi, Governors. Nia Maldonado, Fox 61. My first question is for Miguel. We know there are some busy parents at home that haven't had a chance to look at these guidelines. So what is your message to those parents watching at home right now regarding their fear of sending specifically young children, kindergarten, first grade, back to school come September and enforcing social distancing and wearing those face masks?
Right. You know, I share those same concerns that those parents have. I'm a parent myself, so I look at this from the lens of a parent. I would say, you know, there's information on our website, but the message to the parents is that we're doing everything in our power to promote a plan that has health and safety at the forefront of it. With regard to the masks, it really is going to be, as Commissioner Gifford mentioned, a critical strategy in us moving forward as a state. I know I'm hearing a lot of concerns from families saying, you know, my children shouldn't be wearing a mask. We want to make sure that we're doing this in a way that's responsible so that we can continue to move forward with our education and we can continue to move forward as a state. And the mask, the facial coverings is something that as a state, we're going to have to come together to support our students, help them learn how to do it, maybe start practicing over the summer so that they become used to it. And children are resilient. You know, let's not forget that. Children are resilient. When they start seeing their friends wearing it, they're going to learn. You know, I was an educator in elementary school, and I know we can expect that they participate, and the grand majority of them would be just so happy to be with their friends that are going to follow without issue.
The Associated Press.
And then my second question, Max, I just have one more question
for
the
Go ahead.
Governor. So, like you mentioned, Connecticut has some of the best numbers in the country. Have any state leaders from areas dealing with spikes, high numbers, maybe from down south, reached out to the state to learn from what Connecticut is doing right?
Well, we do talk, just informally. Nobody's saying what's so great about Connecticut, but we just compare notes. And as I think I mentioned, I talked to the governor of Arizona as we compared notes. This is probably a couple weeks ago, and he pointed out, I thought thoughtfully, that perhaps most people in Arizona knew somebody who had lost a job from COVID, but not necessarily somebody who had lost their life. And I think Connecticut was hit pretty hard, and we do know people who have suffered badly at the hands of COVID, and I think it makes us a little more careful. Those are the type of conversations we have. And I got to tell you, as regards Miguel Cardona, a lot of people are asking about our education reopen plan.
The Associated Press.
Thanks, Max. Good afternoon, Governor and everyone. Governor, what is the latest daily goal for testing now, for both diagnostic and for antibody testing?
You want to start with that?
Yeah, we don't have a specific goal established. We're focused on a testing strategy, though, that's been very consistent for probably 2 months now, I'd say, which is first and foremost, everyone who has any symptoms, go out and get tested immediately. That's critically important. If you get contacted by a contact tracer and you've had close contact with someone who's tested positive, go get tested. And then beyond that, we're really focusing very aggressively into the highest risk communities, nursing homes, assisted living facilities, correctional facilities, other congregate settings, as well as our cities that have been disproportionately impacted by COVID. And we've been investing a significant amount of resources from the state to ensure that testing in those sites is readily available, it's free to everyone. And because we know those are the areas where if we are going to see a resurgence, it's most likely going to come from those locations, and we need to be testing aggressively in there. I will point out as well, and we have the data on this in our weekly package that's being published today, those efforts have been incredibly successful. We now had in the last week only 8 positive cases in congregate settings in the whole state. So that's nursing homes, correctional facilities. So that's really tremendous progress from where we've been, and is a big part of the story about why the numbers overall are as good as they are.
So we don't have like a specific number like you did at one point?
No, because you have to understand how many of these variables will fluctuate. You know, the number could be impacted by how many people have symptoms, right? That's not something we can control. Hopefully that number is as low as possible. Equally, the CDC guidelines on testing nursing homes say that if you have the home is completely negative for 14 days, no residents, no staff positive, then you discontinue the testing. That's a good thing. So it's going to vary based on a lot of variables that aren't in our control, so there's not a specific number.
Hey, Sue, I'd also add that we're looking at testing in new ways. It's not necessarily just an individual test. As we try and do more broad-based to see what's going on broadly in community spread, you've heard about pooling as ways we can get more efficient there. We're looking at wastewater treatment as one way we can look at within different communities as a leading indicator for what's going on. And of course, we have the How We Feel app. So there are a variety of different ways we're testing, so we have more broad-based look at where there might be flare-ups around the state.
I'm still doing the How We Feel app, I want you to know. I want to ask, the judicial branch is facing a big backlog, and they've racked up about $4.3 million in COVID-related expenses, but I guess they've received about $1.2 million from the state. Do you expect the executive branch will be able to help them cover that difference?
We going to help you, Paul?
Yeah, we're continuing conversations with all our agencies and the judicial branch as it deals with COVID-related expenses. As you know, those dollars from our CARES Act is supposed to last us the whole year, but I know that we have seen the testimony from the judicial branch, and Judge Carroll and our team at the Office of Policy Management is following up directly with them to get the direct expenses and understanding of those expenditures.
Okay, thank you very much.
Thank you.
The Hartford Current.
Hey there, thanks. Hey, Governor, I just wanted to ask a question. You already talked a little bit about these slight increases in numbers and why they're not concerning just yet. At what point would changes in these numbers start to raise red flags for you all?
The red flags for me are, what you saw in those flare-up states is it was like a hockey stick. It went up very suddenly. It went from 2% to 20% in a matter of a couple of weeks. We're not going to let that happen. I think I look at that 5% number as a number that, in terms of infections, that is a red flag to me. And I look at hospitalizations. Right now, we're in very good standing on both those metrics.
So the positivity rate is still the prime barometer for you while you're watching these numbers move?
I think that's right.
Thanks.
Connecticut Public Media.
Governor Frankie Graziano, Connecticut Public. Just a quick question related to this. 3 legal aid organizations recently signed a letter saying they need to be stricter rules to test staff at nursing homes. Can you just explain why you decided to relax weekly testing requirements for nursing home staff?
I think we got the toughest testing standards at nursing homes probably in the country. But Deirdre or Josh, you want to speak to that?
Yes, I'd be happy to. So we haven't relaxed our standards. I think what you're referring to is a clarification we made in the executive order, which was really just to bring the standards into alignment with the federal nursing home testing. So as Josh was just explaining, that when community transmission is low and you've done weekly testing of staff in a nursing facility, you've had no positives among the staff or the residents for 14 days after consecutive weeks of testing, you can stop and then reintroduce weekly testing if there's a case either among staff or residents in that facility. So that's the clarification that we made. It's consistent with the federal guidance, and we'll be explaining that to legal aid.
What doesn't change in that scenario is the fact that workers still go home. So, I mean, in this kind of a scenario, especially if we're still talking about slight trends upwards, wouldn't you still want to test those folks? Is there an issue with cost? Is that why maybe these standards are relaxed a little bit?
Yeah, just to reiterate, we didn't relax the standards. We just clarified, but it wasn't a decision based on cost. A decision based on coming into alignment with the federal guidance. And as I mentioned, the federal guidance also does say to consider reinstituting weekly testing if community transmission increases. So that's definitely on our radar screen. And for what the governor and Josh were just talking about in terms of our close monitoring of community spread, that if the community spread starts to tick up in Connecticut, then reinstituting weekly testing, even in the face of 2 weeks of negative tests, might be indicated.
The Day of New London.
Hi, Governor. I have a question kind of going off of what Fox 61 was saying. When we're talking about Connecticut having better numbers than most other states, can you point to kind of some specific things that you think Connecticut is doing that is not happening in states where cases are skyrocketing?
Yeah, following the metrics. Everybody has said don't open until you see 2-week, 4-week downward trends in infections and hospitalizations and a number of the graphs that we share with you every few days. And I think some states, let's say, got a little ahead of the curve and opened too early. And I think that was a mistake, that we've erred on the side of caution and opened everything. We were very selective about what we opened and what we continue not to open, for example, bars.
The Connecticut Mirror.
Given the guidelines for the operation of air conditioning and the use of fans, and the fact that 80-degree temperatures are not unheard of in Connecticut in September, is there a contingency plan for warm weather as you guys open schools in September?
Miguel, you're making a good point on mute.
Commissioner Cardona.
Thank you. That's a good point that, classrooms are very warm, especially when the sun is beaming in especially in September. We're kind of like before COVID, many schools, many districts would move students to areas that are air conditioned, whether it's cafeterias or different spaces. Media centers sometimes had air conditioning, and outdoor spaces as well are things that we would encourage. We would encourage that even on days where it's not so hot. Getting students outdoors as much as possible is going to be part of the plan moving forward.
Do you anticipate that this thing is going to continue to evolve, really right up until the opening of school?
I think we have to recognize that this could be here for another year, these adjustments in our schools. So we have to be ready to adapt as we learn more information about COVID-19, but also as the data changes. So yes, we're hoping for continued success with Connecticut's rates, but we're prepared to move as the data suggests we need to move.
And final question for the governor. The criticism today was really, by the Republicans, was really directed at the mass mailing of applications. So my question is, did you support Denise Farrell's decision to send unsolicited absentee ballot applications for the primary? And should she repeat that again in November?
I think so. If it makes it easier for people to vote, and I think we can do that with real integrity, I think it makes a fair amount of sense. But I'm willing to listen to alternatives.
Thank you all.
The Waterbury Republican American.
Thank you. This is a question for Dr. Gifford. I asked the governor the other day. Given the approach to testing in Connecticut, how reliable a metric is the positivity rate when we're not doing broad-based testing, when we're just testing targeted populations?
So the states that are seeing real challenges in interpreting their test positivity rate are states that are seeing simultaneously big growth in their infections and community spread, and also growth in the number of tests that they're doing. We're not in that position in Connecticut. We've been relatively stable in our testing numbers and in our community spread and positivity rate. So under those circumstances, it's much easier to interpret the test positivity. If we start to see one or both of those change, then you have to sort of compare the numerator with the denominator and make an interpretation. but the fact that Connecticut's numbers have been relatively stable within a certain range help us understand that our test positivity really is likely to be reflective of the community spread that we're seeing or not seeing in our case in Connecticut.
Challenge the premise of the question a little bit. I think we are very much doing broad-based testing. I've been on a number of calls, national calls that are set up by the National Governors Association, where you hear the other strategies of other states. Most other states are only testing sick people. So all of those other categories that we talk about in our testing strategy, nursing homes, prisons, in our cities, most states aren't doing any of that. So we're going much further than most states, and that's reflected in the fact, as the governor said, that we're among the top 10 states in the nation in terms of testing per capita. And we're investing significant resources in that because we think it's important for all the reasons Commissioner Gifford just mentioned.
Josh, I've heard that there has been no testing in residential care homes. Is that true?
What was that?
Residential what homes?
Question, please.
Care home.
Care.
I've been told there hasn't been testing in residential care homes.
Right. I can speak to that.
Go ahead, DJ.
Right. So residential care homes are a small type of congregate setting, and we've been working with them and some of our nonprofits to talk about the most appropriate way to do testing. We think in our public health guidance is that routine asymptomatic testing in residential care homes that are not located in one of our high-risk communities is not necessary at this point. Certainly, as Josh mentioned, anybody who has an exposure or who has symptoms should have rapid access to testing, and we would encourage that. Also, for a residential care home that's in one of our high-risk communities, staff and residents should consider regular asymptomatic testing. And our state agencies and nonprofit organizations are working together on a case-by-case basis to understand when other testing might be indicated.
While we're dealing with this unprecedented pandemic of COVID-19, is there a risk of losing sight of diseases that are transmitted by mosquitoes and ticks that occur here in Connecticut every year? We just started our mosquito testing program, and the tick testing is underway too.
I'll be happy to jump in, and I know Dr. Gifford as well from the DPH perspective. I think the short answer is no. We still have a duty in terms of all the relative roles of within state government. An important one is supporting the agricultural experiment station, the work that they do, as we saw in terms of our response on EEE last year and continue to do on West Nile, we've been doing for many of years in the state of Connecticut. It's a cross-agency collaboration with the Agricultural Experiment Station, DPH, DEEP, and agriculture. So I would say as a short answer, no, but you also got my long answer as well.
Appreciate it. Dr. Gifford?
I would just add that I actually heard the report out from my team at DPH on this topic yesterday. Work is underway, as Paul mentioned. We at DPH understand and appreciate we have a responsibility to monitor and continue to do the work, not only in those types of vector-borne diseases, but other types of chronic disease, which continue as well.
And I've also gotten a question about how are health districts supposed to get reimbursed for overtime and other issues. I'm not quite sure if this is right. FEMA care funds only go to municipalities. How do health districts get reimbursement for overtime? I don't know if that's a situation or not.
Commissioner Gifford, do you want to take that?
Sure. So I don't think I can speak to the specific issue of how local health districts manage overtime, but I can tell you that we have received at DPH some stimulus dollars related to the pandemic response, and we're in the process now of working with our local health districts to get some of that funding out to them. help support them in the activities that they've been doing related to COVID. So I think that will definitely alleviate some of the pressures that they have been feeling regarding additional responsibilities during the pandemic.
Okay, thank you very much.
CT News Junkie.
Thanks, Max. This question is for the governor. Early in the session, before COVID closed the legislature, Connecticut Against Gun Violence was advocating for a permanent commission on gun violence. And urban gun violence disproportionately impacts African Americans and Latino communities. So as part of the drive to address racial inequities and police accountability, has there been any thought to forming a permanent commission on gun violence to look at evidence-based solutions?
I think that's a very good point, Christine. We ought to dust that off if we're not making progress on it now. And I know coming from Senator Winfield and Representative Staffstrom, perhaps that should be part of some of the police accountability provisions we're thinking about.
And this question is for Josh. Josh, how long is the state going to backstop with PPE municipalities, businesses, and nursing homes?
We haven't made a final determination on that yet. We're certainly hoping and seeing that many of the organizations that we have been helping to backstop have become more self-sufficient as the supply chain is stabilized in many cases. You know, we do have a request into the federal government to extend the National Guard deployment, which is set to expire in early August. National Guard has been absolutely instrumental in our PPE supply chain, staffing the warehouse, staffing the distribution. So if the federal government doesn't extend that could become a challenge, but we're working on contingency plans as well.
Has the supply chain gotten a little tighter lately?
You know, we're talking to our suppliers every day. So far, no one's buckled on us, but obviously we can see what's going on in other parts of the country, and we're following it very carefully.
Thank you.
Let me just say in conclusion, I guess I've sort of picked on bars and nightclubs as places that we've been very reluctant to open because of the risk of contagion. Max reminded me that we also never opened up sleepaway camps because we thought of the risk there that it could catch on fire, so to speak. And he reminded me that there was a sleepaway camp in Missouri just in the last few days where there are over 80 infections of campers and staff there. And 80 infections for us would be almost a doubling of our infection rate. So it reminds you what a thin margin for error we do have. I'll tell you something else. I heard Ken ask the question, you know, are people still paying attention to the protocols and taking it seriously with a lot of warm weather out there? And a relatively tough grader. I think a month ago I gave us, you know, more like an A-. Today I think it's more like a B+. And we're on the call with all the mayors and from around the state just last night, and they told us of a number of, you know, sort of big party-like events. It's not Lake of the Ozark type parties, but parties that you could potentially, you know, have some real risks there. So we're watching that carefully and reminding everybody to wear the mask. And with that, we've got yet another of our PSAs that are out there to remind people to wear the mask.